Yeah, thanks so much. Okay, let me try this again. Okay. So what is the purpose of the water using the powered instrument?
It's to cool it down.
Okay, one is to cool it down. What's another?
To irrigate.
Yeah.
To irrigate, right. Good job. Okay, so between the ultrasonic and sonic, which one's going to be the most powerful?
Ultrasonic.
Ultrasonic, right? We don't really use sonic instruments anymore. So those ultrasonics are broken down from piezo to magneto. So the main difference between piezo is that it's activated at the end by crystals, and so it doesn't require as much water as you would need for the magneto, because it has to cool all of those stacks all the way down the handpiece. Typically, people aren't as sensitive with piezo as they are with the magneto. One, because it could get overheated faster, but also the motion that it goes through. So can y'all see my face too? Okay. So the magneto is going to be like, it's going to hit the tooth like this, and the piezo is just going to do this, right? So it's not going to be as sensitive on the patient as the magneto would. Okay, what is a limitation to using an ultrasonic?
You have less tactile sensitivity.
Less tactile sensitivity, right? What's another thing?
Takes more experience to use.
Yeah, so some people think that the ultrasonic is just like a magic wand, but it's not. You really have to know how to utilize it. Someone could use the ultrasonic for 2 hours and not get a single piece of calculus off. So you have to have the right technique, which we'll practice a lot when we get back. Okay. Contraindications. If your patient has respiratory problems, they have demineralization, if they can't swallow properly, you don't want to use ultrasonic. Why do you think that you wouldn't want to?
There'll be a lot of water.
Water, and so they're at risk for what?
They're at risk for aspirating.
Aspirating, right. Aspirating. Implants, you have to have a certain tip for the implant. We don't have one, but it has a plastic covering on it. This thing where it talks about cardiac implantable devices, that's if they have a pacemaker and it has to be shielded. If it's shielded, you can use the ultrasonic, but if it's not shielded, then you would use the piezo. But if they've had a pacemaker put in the last 15 years, they're all shielded, so you don't really have to worry about that. Okay, so as far as like grass and finger rest, what is the difference between hand instruments and your ultrasonic?
Sometimes you have to use extraoral fulcrums for the ultrasonic.
Right, so you can use extraoral fulcrums. What else? What about lateral pressure?
A light lateral pressure.
Light lateral pressure, light grasp. The more pressure that you're putting on there and the tighter your grasp, the less effective that the ultrasonic is going to be. So remember, it's just really light, just how you would use with your Explorer. The assessment endpoint is the Explorer. You have to pick up your Explorer to know what you've gotten off. Like, you'll see it fly out if you're using it properly, but sometimes you may not see it, and so it's good to always pick up your Explorer. Okay, these are the different approaches. This is with the ultrasonic. You see how you start coronally, and where are you going to move?
Apically.
Apically, right? So your hand instruments are going to be different. So it's known as like a top-down approach, meaning you start on top of the calculus and you move your way down. Does that make sense? Okay. So because the crystals are at the end of the piezo, only the end of the working area needs to be cooled, and the magneto requires more water, which we kind of already talked about that. Okay, so as far as strokes go, with an ultrasonic, it's not going to just be one stroke. You're going to have to stay in that area and do multiple strokes. And so just, it's not faster than hand instruments. Maybe it is supragingivally, but it's not faster subgingivally. It actually takes about the same amount of time because subgingival calculus is a lot harder to remove than supra. So I would just want you to know, like, don't get frustrated if you start and you like do a couple strokes and it's still there. You're not doing anything wrong. It takes a while to break it up. Okay, so standard tips are going to be larger in size and have a shorter shank. Why do you think the slim tips have a longer shank?
To get into those deep pockets.
Yeah, so you got to get into those deep pockets. That's great. Thanks, Lena. Okay, so tips are going to be different. They're going to be different in size, shape, length, and curvature. So it's going to be dependent on where the calculus is. Is it sub or is it in a deep pocket? How big the calculus is. So if it was a big piece of calculus, would you use a slim or a standard tip?
Standard.
Standard, right, great. This is the standard tip. As you can see, the shank is shorter in comparison to the slim tip, right? The slim tip is going to be 40% smaller in size, which is pretty significant difference. Okay, remember what the rectangular or cross section of the tip. So if it's rectangular or beveled, what is that going to be more effective in using, in getting off?
Calculus
removal.
Calculus. So all piezo tips are rectangular in cross section. Okay, but magneto, they're not all rectangular in cross section. Some are round and some have an edge. The ones that don't have an edge, what do you think is going to happen to that calculus more often than if you had a beveled side?
Burnish
it, right? Because it's just like going to take it off in layers. And that's actually how magneto and ultrasonics work. They take it off in layers instead of cutting into it. So a lot of times people are going to be more likely to burnish calculus using a Cavitron versus using a piezo. You need to learn how to use both, but the piezos that we have are more powerful than the Cavitrons. Okay, so round and cross section, what is that going to remove?
Biofilm.
Biofilm, I really like calculus, yeah. These are the dental implant tips. See how it has a plastic covering, and that is just going to protect the titanium implant. Okay, does anybody remember about the wear? If you lose a millimeter of the end of the tip of an ultrasonic, how much less effective is that tip?
25%.
25% less. Okay, so if you lost 2 millimeters, how much less is that effective?
50%.
50%. And so once you get to the 2 millimeters, what should you do with that tip?
Throw it away.
Throw it away, right? So they can't be sharpened like your insurance, so you have to discard it. And how you tell if it is, if you've lost something, you have to put it up to a wear guide. That's the only way you're really going to be able to tell if you have anything lost. Okay, so magneto, how do they, what's their motion? How do they move? Figure eight, right? Elliptical motion. And what are the two sides that you would utilize after the tip?
The front and the back.
The front and the back. That's great. These are magneto tips. This orange one has an edge on it. And so it's rectangular in cross section, and the pink one doesn't. It's round in cross section. These are other tips. We don't have, this is actually the Cavitron tips. We use Hue 3D, so ours don't look like this. What is this tip?
That's the beaver tail.
Beaver tail, right? So where are we going to utilize this?
Supragingival with really heavy calculus.
Supragingival with heavy calculus. And it's kind of common sense. Like if you look at this tip, do you feel like it could fit subgingivally? No, not really. These are left and right tips. We don't have any of them, but they're kind of, they get into furcations easier than a regular standard or slim tip. But you have to use both the left and right side to clean the whole mouth. So you can't just have one of them. Okay, so piezo. What motion is a piezo?
Linear.
Linear, right? How is the end of the tip activated?
With the crystals.
Right, so it's going to fire up those crystals. Okay, so this is really important. You never want to touch the end of the tip to enamel or the root. It will, especially our piezos are so strong, you could damage the tooth. You could do a crown prep with the piezos that we have. So this would not be a correct adaptation, all right? This would be the correct because you're using the lateral surface. Do you think this is a transverse or vertical orientation?
Transverse.
Transverse, right? So transverse is going to be more perpendicular, like this. And you see how they're starting on top of the calculus, and they're going to move what?
Apically.
Apically, right. Great.
Dr.
So,
Tucker,
yes, ma'am.
which one did you say you use the lateral sides for?
The piezo.
Okay.
So transverse orientation is good for calculus that's not that deep, so it's just slightly sub. But the vertical orientation is more parallel. You see how it's placed in there vertically, and this is going to be better for deeper pockets. Does that make sense? Does anybody have any questions? Okay. I'm going to talk about that. These are the left and right tips. So if you can't get the calculus off, what are some things that you might think about if it's not working?
You could change tips or change the type of stroke you're using.
Okay, yeah, so check your strokes. You want to make sure you're doing overlapping strokes, and you want to make sure you're where it is, so you feel the calculus. Also, so if you're like if it's somewhat deep, but the calculus is really tenacious, and you can fit a standard tip in there, then I would change to that. But like on an exam, if it says if you're in a deep pocket, what's the answer going to be? What tip do you need to use?
Slim.
Slim, right. Okay. So what kind of tip is this used for? It's called a diamond tip.
To remove overhang.
To remove overhangs, right. Okay. This is a furcation tip. You see it's the ball tip, so you just kind of roll it in that furcation. We actually need to order some of those. We don't have that. All right. Okay, so ultrasonics are going to produce aerosols. All right, so what kind of suction do you need when you utilize the ultrasonic?
The high speed. My evacuation.
High speed. So y'all are going to learn how to use the high speed. It's going to be a little bit different with all the COVID stuff because technically you're supposed to have four-handed dentistry right now. So we're going to try to set it up where all the patients are staggered so you can have help with the next person, the person beside you, if you're needing to use an ultrasonic. But eventually you'll be able to, you'll pick up on it pretty quickly, how to utilize both of it at the same time. So before you use, really right now you have to do this anyway, but what does a patient need to do before you use something that causes aerosols?
Do a rinse to help
Yes.
deal with bacteria.
Yeah, you're going to do a pre-procedural rinse. We're going to do a procedural rinse on everybody now. And we typically used to use Listerine or Crest for Health, but now we have to have something that has hydrogen peroxide in it. So that's going to be different just because of COVID. Okay, does anybody have any questions over the powered instruments? Do y'all feel like that you're learning from the recorded lectures, or
Yes.
okay? So
Yeah,
this is,
I'm sorry. I like that what we did today, how we kind of just skim through it and go over it just to see if we have any questions.
okay, yeah, that's great. Yeah, so I didn't really know like how much time it would take, to get through everything and do our activities, but yeah, so if it seems fast, just let me know, or we can slow down, or we can do more time on Zoom, or whatever y'all need. So this is new to me, this is new to y'all, so if you have any suggestions, please shoot me an email, and I'm more than willing to make an adjustment because I want to make sure that y'all's needs are met through this. Okay, I'm gonna stop sharing the screen. Okay, so now I know we only have about 14 minutes left or something, but I'm gonna put y'all in breakout groups so that y'all can share with each other kind of like what y'all did with your care plan. And then tomorrow, or when we meet next time, I think it's Monday. And when we meet on Monday, we can kind of do a recap of what that was. And then don't forget to do your case study. Your case study is going to be due before Monday. And then we're going to do airflow next.
Case study is just that quiz, right?
Huh?
The
Just-
case study is just that quiz.
Yes. Yep. It's
Okay.
under the case studies, and it's quiz 1. The case
Okay.
study 1. Yeah. Yeah. Okay. Let me see how I can. Okay, I'm gonna put y'all in groups of 4 or 5. You might have that. And then I've never done this on Zoom, so hopefully it works.
Are those quizzes for the case studies timed?
No,
And I ask that because I have to keep going back and looking at the,
no, there's no time on it.
okay.
Okay, anybody have any other questions before we go in the breakout?
Are we allowed to like work ahead? Like,
Oh,
can
yeah.
we do case study too, even though
Oh, yeah.
it's not due?
Yeah,
Okay.
that's why I opened it early, just so there's some people that have already done it all.
Okay.
Yeah, so feel free to work ahead. And if you have a question about something that you've gone ahead of, just shoot me an email if you have a question. Okay. I don't know. Is it not, are y'all able to join? the groups.
But I think also for the self-care ability, is that when you'll, oh,
Sorry, Kelsey. I didn't realize you were in a group by yourself.
I had like 4 other people, I think, but I just moved.
Oh, you did have other people?
Yeah.
It's good on my end that you're in a group by yourself.
Guys, did I
Sorry.
move?
All right. Are y'all doing okay?
Mm-hmm.
Okay.
Yes. We were talking about the dental hygiene diagnosis and kind of what everybody
Okay.
came up with to put for the related to risk factors and etiology and stuff.
Okay, great. Great.
Extra oral was
Okay.
within the limits. Do what, Dr. Tucker?
Are y'all doing okay?
Yes, ma'am.
Okay, great.
And then he had
Dr. Tucker?
Oh.
Okay, so
Are we supposed to all be here?
I don't know. I think I'm just gonna get off because I feel like she's not gonna come back on.
Okay.
Okay.
I think the breakout room should close in about 8 seconds. So
how smoking can affect oral health, and then his last appointment, I said do reevaluation, take X-rays, black index score, and a new perio chart. I'll suggest to a patient about buying over-the-counter disclosing solution. So when brushing at home, you know, he can see what he misses.
hey, Mallory, we're all in the group again. Sorry.
No, it's fine.
You did a great job, Mal.
Thank you.
All right. So did everybody kind of had the same thing going on? Okay. Anybody have any questions with the care plan?
What? Morning. Oh, morning. Oh, we're in class. I was just wondering what's.
Okay. Anyway. All right. Okay, guys. Well, I'll see y'all Monday. Y'all have a good weekend.
Thanks, Dr. Tucker.
Thank you.
Bye.
Bye.
Hey, Dr. Tucker,
Yeah.
are we still doing Zoom meetings from here on out?
Yeah, I think everybody preferred Zoom.
Okay.
Is that? Yeah, I'll send them out.